Thank you all for joining us today. Our webinar, Aligning Your Children's Hospital with Community Providers, is hosted by Proficient Health, WakeMed Children's, and PM Pediatrics. I'm your host and moderator today, Erica Grau, Director of Marketing for Proficient Health. All right, let's meet our presenters. Dr. Karen Chilton is Chief Medical Officer of WakeMed Children's and the Associate Chief Quality Officer for WakeMed Health and Hospitals, as well as a practicing pediatric hospitalist. She attended medical school at the Pennsylvania State University School of Medicine at Hershey Medical Center and completed a residency in pediatrics at the University of North Carolina. She has been with WakeMed since 2004. Dr. Stephen Lineweber is the Vice President of Strategy for PM Pediatrics. He also serves as Vice President of Clinical Operations for PM Pediatrics in the Midwest Southeast regions. Dr. Lineweber completed his fellowship at Duke University Medical Center and his residency at Cook County Hospital. He received his medical degree from Rush University and Bachelor of Arts from University of Notre Dame. Deborah Lowry is Vice President of Marketing and Communications for WakeMed Health and Hospitals. She has been in the role for 24 years and is responsible for all corporate communications, marketing, public, and community relations activities for the health system. She has 37 years of healthcare communications and marketing experience at facilities ranging in size from a small rural hospital in Wyoming to a large integrated academic health system in New York City. Deb holds a BS in journalism and an MBA from West Virginia University. Dr. Hoover is hopefully going to be joining us throughout the presentation, is a practicing surgeon, Director of Pediatric Surgery Outpatient Services at WakeMed Children's Hospital, and Chief Medical Officer at Proficient Health. Dr. Hoover is known for his innovation. He was the first surgeon in the country to use magnets to correct the innate absence of a portion of the esophagus. He earned his medical degree at East Carolina University, completed residencies at Northwestern University and Carolinas Medical Center, and was awarded a fellowship in pediatric surgery at Children's Memorial Hospital in Chicago. All right, I'm going to pass it over to Dr. Chilton, who will walk us through an overview of WakeMed.
Thanks, Erica. Good afternoon, everyone, and I hope that all of you across the country are finding ways to stay cool today, if it's anything in your area like it is here in North Carolina. So I thought we would just give you a real brief overview of WakeMed Children's and who we are to start off. So we are what we affectionately refer to as a children's hospital within a hospital. And WakeMed is a large community health system with a level 1 trauma center. And as far as our children's hospital goes, we have approximately 32 acute and observation beds, as well as a 10-bed pediatric intensive care unit and 48-bed neonatal intensive care unit. We also have smaller neonatal ICUs in our 2 smaller campuses, and a 5-bed pediatric inpatient rehab unit, which maintains the CARF accreditation and meets all rehab standards and is located right within our pediatric acute care unit as well. We have a dedicated children's emergency department, which stays very busy and sees approximately 40,000 visits a year. And then we see an additional 20 to 30,000 kiddos at our outlying EDs annually throughout the system. In addition, we recently entered into a joint venture partnership with PM Pediatrics Urgent Care, and Dr. Lineweber, he's going to get me for that, is going to give you an overview of PMP.
It's a good thing we've been friends for over 15 years, Karen. Thank you for handing it over to me. So PM Pediatrics is a pediatric healthcare company that was started in 2005 by the 2 founders, Dr. Jeff Shore and Steve Katz, on a and a belief that there is a better way to provide pediatric care. And they built this company with the idea that it would be a true alternative to the emergency room. And so it was founded largely on pediatric urgent care. And over the course of the last 16 years, that company has grown. We've seen over 3 million patients. We're on track to see over 1 million patients this year across 14 states and 70 sites. COVID, as I'm sure has affected everybody's healthcare plans, accelerated our move into pediatric telehealth. And over the course of the last year and a half, we've been able to perform over 400,000 telehealth visits with throughout the country. We also have, we're proud of our partnership with WakeMed Children's. It's one of our 4 health system partnerships. We have 3 other health systems that we're in partnership across the country. And then we have a couple more in development. Throughout COVID, we began to look deeply at who we were as a pediatric healthcare company. And what we realized quickly was the growing behavioral health need and our ability to potentially utilize our virtual platform and our relationship within the communities and within pediatricians. And we just successfully launched our behavioral health service line, which has 2 different models that we're doing. And so it's really a pleasure to be here with all of you today, with my friends at WakeMed, with Proficient Health. And I'm looking forward to this conversation that's so needed with regard to how do we stay connected and really think about how do we lead healthcare, pediatric healthcare, what I like to call, developing a real true pediatric neighborhood that supports the pediatric medical home, but makes a great safe place for our kids to live and thrive. So thank you for this opportunity.
Thank you both for that lovely introduction. And I just want to remind our audience members that we do have time at the end for questions. So if you have any questions throughout our live event, feel free to ask those in the Q&A portion of Zoom. All right, so Dr. Chilton, let's talk about the history of WakeMed and really why was it so important for community providers to have a seat at the table?
Sure. So historically, pediatric services at WakeMed Children's were really grown by our community providers. So nearly 30 years ago, our local community providers, there's a small subset of them who helped to really develop the first pediatric intensive care unit here in Wake County at WakeMed Children's, and also really saw the need for dedicated pediatric emergency care. Here in Raleigh, North Carolina, similarly to, I'm sure, a lot of your communities around the country, over time, we started to follow the same trend that developed in adult care, acute care medicine, in that less and less frequently were the community providers coming to the hospital and admitting their own patients and taking care of kids who were sicker and sicker and more acutely ill as they were in the hospital. And we started transitioning more to this hospitalist model, which is what we have now. But even prior to that, we were in a little bit of a unique situation because within 20 to 25 miles of us, we had 2 large academic health centers, UNC and Duke. And while the community providers around Raleigh who were, really frequently admitting kiddos to the hospital here or seeing newborns at WakeMed, while they appreciated the subspecialist support and the resources that they had from these 2 large academic centers, they also saw over time, as our county really took off and grew as the capital county of North Carolina, that there was a need to be able to continue to develop services right here in Wake County and keep really the vast majority of kids, if possible, here in their home county and closer to home when they were acutely ill. Recognizing that, as I mentioned, sort of in the shadow, so to speak, of 2 large academic health centers, the way we are, we will never do all of the things that you can do at a really large, tertiary or quaternary center. But there was definitely recognition along the way and through this transition of community providers sort of moving more so out of the hospital and hospitalists and acute care providers staying in the hospital, that we really needed to be communicating with each other. And the way that we were going to effectively grow and be able to keep kids here in the county when they were sick was to do it together and to put all of our heads together to figure out what the needs were and honestly what it was realistic to keep in Wake County, what we still needed to be leaning on Duke and UNC for. And so that really is sort of how a lot of those conversations began, and honestly how they continue today. And so, as we entered into various phases of strategic planning over the years, of which there have been many at this point, we tried to be really intentional that community providers maintain significant seats at the table when we're having those strategic conversations. First and foremost, they are the ones really out in the community seeing what the needs are of their patients when their patients come seeking care. And so we need their input from the hospital standpoint, but also because historically they are they are the folks who truly built us in the first place. So that's kind of where we started and how we've gotten to where we are today.
That's great. I'd love to transition to our first topic of discussion with you on engagement. So tell me, what has Wake Med Children's done to increase engagement between community providers and the hospital?
Sure. I think one of the key components is that we've recognized that people prefer communication and engagement to come in different forms. So what engages one community provider is not the same thing that's going to truly engage another community provider. We had, even as we had developed a very robust hospitalist service here, and very few of our community docs were still coming and admitting their patients to the hospital, we had maintained a very regular and robust grand rounds program. And for many years, a lot of them were still coming to the hospital in the morning, twice a month. And we would share both clinical talks as well as share information about what we were seeing in the hospital, what was going on at Wake Med at large. And that was always really well received and well attended. But not surprisingly, in most recent years, and then certainly when COVID struck us all down, there was much more of a demand or an ask for the ability to be able to continue to participate in those kinds of learnings and conversations, but without having to, drive from their office to the hospital, park in the parking garage, find where they were going, attend the talk that takes an hour, turn around to get back out of the parking garage and back to their offices. And with increasing pressure for community docs to be in the office and seeing patients, they felt that their commute time back and forth and getting on and off of campus was time that they could better spend in the office. And so we had really been working on trying to create a grand rounds experience which would still be valuable to folks, but more convenient when COVID put the fast track on that. And so we went from really doing this in person 100% of the time to doing it via a live format, very similar to this, where people could still be engaged and ask questions of the specialist or the expert who's providing the talk, but then also recording it and therefore allowing people to be able to also get the same information on their own time, but those who chose could participate in the live format. So that's just one kind of simple example of stuff where we heard feedback and we were moving in that direction even before we were sort of, our hand was forced to do that because of the pandemic.
Yeah, go ahead.
Another mechanism of this was that, again, recognizing that a lot of these pediatricians who had been very active in the community for many years had not been physically present here in the hospital nearly as often. brought us to develop what's called our Children's Advisory Council. And so after one of the early strategic planning sessions, when we really had great engagement from some community providers, we decided to maintain this quarterly meeting called the Children's Advisory Council. And that puts some of our key community providers in the same room with the key both children's hospital leadership and overall system leadership, and allows us to have ongoing conversations about challenges here within the walls of the acute hospital, challenges for the WakeMed system that spill outside of the acute care hospital walls, and then challenges from their side, from the community provider perspective. And so we continue that to this day, and have this quarterly really touch point where we can introduce new services, new providers, new things that are going on within the hospital, talk about things that have worked and haven't worked, why something that was perhaps suggested in a strategic fashion is going to be developed or not developed, and then to get ongoing feedback from our community. And so then that's our goal, is to continue to have them regularly participating in these types of things going forward, whether it's a big, very much planned strategic session, or more informal areas where we just seek that ongoing feedback on a regular basis.
Great. So you kind of touched on how information flows throughout your organization. So tell me, how does open communication impact and benefit patients, providers, and the hospital?
Sure. I think we all recognize how important communication is. And as the Associate Chief Quality Officer here of the entire system, those of you who spend a good chunk of your lives in quality and safety recognize that a whole lot of the things that don't go well in healthcare can almost always be tracked back to communication. And so we definitely recognize the importance of communication. I think from a patient standpoint, it's sort of a no-brainer. So the more coordinated your care is, the better care you receive. So the ability for providers out in the community to be able to easily reach our providers here within the hospital undoubtedly improves the handoff for a patient and the care that they receive when they show up on our doorstep with an acute issue that requires hospitalization, and vice versa. I think from the discharge standpoint or handoff back out to a community provider, more openly and easily we're able to communicate information back and forth, the more likely that community provider, who's then going to be the person seeing this patient on an ongoing basis, can provide seamless care after a patient leaves our walls. The benefit for community providers, from what we have heard and the feedback we've received, is that the less friction that they have being able to reach the person that they need to know about a patient who's going to be coming to the hospital for care, the easier their life is. So the less time that it takes a provider to look at a patient and make a recognition that, gosh, I think this patient needs to go to the hospital, the easier we make it for them to reach me as the admitting hospitalist and get the information to me, and the less time it takes them away from their next patient, for instance, for that to happen, the easier it makes their life. And I think that those kinds of things all contribute to our ongoing stressors and burnout rate that we have in the community. And so when we make that easier and decrease the friction in those interactions, I think that helps to prevent things that can ultimately lead to burnout and provider dissatisfaction. I think it also gives community providers the sense and confidence that they have, handed off this patient in a logical way, that they've gotten across the information that they wanted to share, and they are able to feel good then about handing that patient over to our care. Recognizing that we still have some providers within our community who used to admit their own patients and follow their patients through the hospital. And so I'm sure you all do as well. And for those providers in particular, it's important for both the patient and the provider to feel confident in the receiving team in the hospital. Proficient Health has been one tool actually that's really helped us with that, because it's seamless the way that our schedule flows into the texting application. And so if I have a community provider who needs to admit a patient, with literally 2 taps, they can find out that I'm the one who's on call, and they can either choose to call me directly through the app, or they can send me a secure text message, and then I can call them directly back. And we have heard from our community providers that particularly when a patient requires a direct admission, that has really made life easier for them. And then I think from the hospital side of things, the benefit for the hospital is that not only can we provide better care while a patient is in the hospital, but we also can maintain this open communication with our community providers that we were mentioning before, which helps us as the acute care provider to know, gosh, our providers, patients out in the community really have a need for X, Y, or Z. And so we need to be thinking as we become even more so our community's health system for kids, how do we develop those things that are ongoing and growing needs that the providers are identifying? And if they don't have a way to communicate that to us, then we'll never know about it. But if we are actively having two-way communication back and forth, then it really helps us to be able to start to look at what those opportunities are before we're way behind the 8 ball and patients are really out there in the community without the services that they need.
That's great. I'd love to hear, Dr. Lineweber, from your perspective, how does working together help develop a culture of quality between the Children's Hospital and community providers?
Sure. I think kind of building off of Karen's story, I think quality is something that our patients take for granted, every time they engage for care. And so it's really, what are we doing as providers in that neighborhood that I talked about to make sure that that's the highest quality? And so you only are going to be able to know that you're providing the highest quality of care if you are kind of holding each other accountable, not kind of actually holding. So you need to be able to engage with each other, the hospital, other healthcare providers like BM Pediatrics, and then the community pediatricians in that neighborhood, and say, what is the quality of care that we're providing the children in this community? And so that kind of exchange of data, what are your readmission rates? How do you treat asthma? For us in the urgent care setting, our antibiotic stewardship is essential for us to be able to share with the pediatricians how often we use a chest x-ray, because we want to be judicious in the exposure of children to radiation. And so having that, sharing that information with each other elevates that quality and really develops that highest level of care. I was thinking that, one of the reasons that we have a partnership with Wake Med in the Raleigh area in Wake County is that the pediatricians really voiced a concern. They said, we love the pediatric emergency room. We love that you guys have built the first pediatric emergency room in the community and you have a fellowship training program. But gosh, it's an expensive place for care. And there's many kids that don't need that care. They really need good after hours urgent care. And so that's how we developed the partnership with Wake Med. It was to bring in that really high quality pediatric urgent care, because as things move towards value, where we want to have the highest quality at the lowest cost, good pediatric urgent care is a major driver of value in any kind of healthy community. And so we've been able to do that together with community pediatricians, with Wake Med and BM Pediatrics. And so that's been a great part of our work together.
All right, so I have another question for you. So how does technology play a role in impacting quality and control provider burnout while improving access to specialists?
I think technology, developed the right way in the right hands, can solve many, many, many problems. I think we all, have the ability, I'm doing this on a smartphone from, a friend's apartment. And so that's definitely helping me be in a different place in a different time. And so, but having said that, as we develop different technology, I think the electronic medical record, while, it promised to be a great source of freeing us from the pen and paper, I think we can all readily admit it hasn't delivered that promise of reducing burnout. And, some studies suggest that it's increasing burnout. And so I think each time you bring in new technology, I think you need to take more of a designer approach to it and make sure that all participants in that technology are at the table to develop it and really utilize it and optimize it. I think a lot of times we bring technology and sort of turn the switch on and use it like it's out of the box. And really these tools need to be refined and redeveloped and coordinated to be able to use it much more efficiently. I think, we've talked a little bit about our ability to use the Proficient technology. I think that has been a real game changer to be able to get a patient either from a pediatrician's office or an urgent care. Let's say we diagnose appendicitis, we're able to use that technology to give that warm handoff and transfer that patient through a system digitally and literally, that I think the patients really appreciate. And I think as pediatricians, we appreciate being able to reach each other and have a conversation about a patient. Because I think one of the things I find is that, technology, if it creates walls and doesn't enhance relationships, can lead to more burnout. If we can use technology to reduce the walls, reduce the friction, create relationships, create an easy way to have a conversation with each other, either asynchronously through a text or even better, directly connecting with the right person, as Karen suggested, who's on call now? I need to reach this person now in this role. That's the kind of smooth technology that makes our lives better, the smartphone that I'm utilizing right now. So.
Awesome. You had kind of briefly talked about it, but let's talk about the need you saw for the pediatric urgent care.
Yeah, I think that, one of the things that we know in pediatrics, when you look at ED utilization, we certainly can say to ourselves that there is a significant portion of that care that does not need emergency level care. And with that level of care comes much, much higher costs. And so PM Pediatrics was founded on this basic principle that, we could do 90% of what we do in the emergency room at a much lower price point, and partner with the pediatricians and the hospitals to really provide this higher level of care. Now, to do that, we have specially trained people and staff, physicians, providers, that we can be able to put in IVs, give asthma treatments, get labs and x-rays, and do things like that. But we've really found that that's been able to deliver really, really high value. Now, one thing that comes up time and time again was, aren't you in direct competition with the pediatricians? Well, we actually have built the model so that, we're open noon to midnight. And so 80% of our patients come after hours, after 5 o'clock and on weekends. And so we're really trying to fill a need in a niche that isn't there. And, our real competition in the market, and the real, I think, as always in pediatric care, is the adult-centric care that then says we're going to go ahead and see children. So there's a lot of urgent care out there that is much more adult-centric, that's seeing kids, and that's where we see the quality drop off, the patient experience drop off, the ability to have a direct relationship with pediatricians. We send all of our charts to each pediatrician's medical home, so they know that their patient was seen, what we did to them, and why we did it to them. And so that's really, really important. And so that's how we've developed this pediatric urgent care. We see ourselves being that in that pediatric neighborhood with the Children's Hospital and with the pediatricians, really trying to elevate the level of care for everybody.
Great. Another great use case that I'd love to kind of chat through. Dr. Chilton, let's talk about the pediatric sedation suite at WakeMed.
Sure. Yeah, this one is another good value story similar to what Stephen just mentioned. So we had a fair amount of kiddos requiring minor procedures or radiology studies that necessitated sedation. And what we heard from our community providers was gosh, we appreciate that you guys are able to provide these services for our kids, but number one, the process is kind of clunky, and number two, it costs the families like a gazillion dollars. And so the reason for that was that we were honestly doing a lot of these things out of a treatment room that was our procedural space that was located within our pediatric ICU. And that comes with a couple of challenges, one of which was, pediatric ICUs are not calming, low stimulation environments, as most of you are aware. And then the second big challenge was it inevitably came with a big facility fee for families. So we heard this concern from both families and the community providers who were taking care of them. And we coordinated the development of a fully ambulatory pediatric sedation suite, which allowed us to keep these kiddos out of the actual hospital space from a charge standpoint, and also to really tailor the environment and the workflow around the needs of the kids who required anxiety-producing procedures, which, as we know, produce anxiety both for kids and parents. And so I'm happy to say that this has been a really successful venture for families, in that we've driven the cost of most of these procedures way down. And so things that are minor surgical procedures that really the surgeons feel like they're very comfortable doing outside of the operating room, or MRIs, a handful of all kinds of things, we're able to handle them through this ambulatory suite. And then I think the piece of it that we're truly the most proud of, and our real measure of success in this, is that the suite and the team that works in there has received the PRC 5-star award every year since we've opened the suite. So for almost 5 years running now. And so that says to us that we're doing the right thing for patients and families. And this, again, kind of grew out of communication with these community providers who said, we think we need to think about this in a different way.
That's great. So finally, I'm going to transition it over to Deb for our third topic on communication. How does the marketing and communications department support WakeMed and community providers in working together?
Thank you, Erica. I think we heard time and again from Dr. Chilton and Dr. Leinenweber how important communication is across all of the different, not only providers, with families, with the community, but it's such a key role that marketing and communications at WakeMed is a centralized function. It supports the entire the whole system from one department. And I think the reason that is really important is that there's so many synergies that can be built when one area kind of really knows what's going on in a different area, and we're able to combine messages, tailor them to our specific audiences. We do have people who are dedicated to just children's services, which is nice because they're able to spend efforts, really to not only help with provider communications, but also communicate with patients and the community. We really do use every channel that exists out there. I don't think we're any different from any other organization, but I think what is different is that we're at the table with the Physicians Advisory Council. We hear from them what they need to know, how they want to know it, what's important to them, and then we're able to tailor our different tactics and tools according to what we hear. The same thing happens at the strategic, with all of our strategic planning. Just being there, knowing what's important, knowing what's being built upon, can really help us frame the message and all of the tools and the information that we need to get out and to what different audiences. So I think the takeaway is really being there, being present, being participating, really just having a seat at the table so that we can help, because there's been many a time, and I'm sure many of you have experienced this. They're like, let's go with this. And then we're able to ask the outside in kind of questions as, yeah, are we really ready for this? Or what is it we need to do to make sure that we are in the best position to deliver on our promise and to continue to build trust and confidence in our providers, in our staff, and in the community and the patients and families that we're serving.
That's great. You had mentioned some of the different communication channels that you guys are using, but maybe expand on what communication channels and methods does WakeMed use to communicate with specifically community providers?
So I think one of the biggest ones that we use right now, understanding how time challenged everyone is it's called A Word from WakeMed Children's. And it's not brilliant, but it works. And that's an email newsletter that we send out every other month. And we chose every other month intentionally, not to fill inboxes too frequently. And it's truly messages from our chief medical officers, from the director of the Children's Hospital. It is really what is happening within your children's hospital that you need to know about today. And it's short, which is really, really key. It's not a long read, lots of bullets, lots of subheads, so that people can really glance at it and get the key takeaways, and then offer an opportunity if they have further questions or want to reach out to somebody, who that someone is, so that they can follow up with any additional questions or information that they may need to know. That has been incredibly well received. And we have also expanded who that goes to. Originally, it was really, the real local right here in Wake County providers who we see and interact with fairly regularly. But since many of our services now are becoming more regional in nature, particularly with our pediatric surgeons and some of the unique work that they're doing, we've been able to expand the reach of that newsletter into the region and to those referring providers, which has been really helpful and honestly has helped to grow referrals. I mean, at the end of the day, that's always really what we need to do. So that's been very effective. I think another one is, again, these are things that many of you all have probably done over the years. We have held good old-fashioned meet and greets at a restaurant, at a bar, because honestly, with the growth of and the addition of so many subspecialties into our children's hospital, which is one of the things we heard very, very clearly from our community physicians that they wanted, and they wanted to have a local resource for pulmonology, for GI, for surgery, for orthopedics, for any number of specialists. How do they get to know one another? How do you build that trust and confidence from provider to provider? And it's still a relationship thing. It really, really is. Who am I comfortable with because I know them? I've met them. I've had a good conversation with them face to face. And you know what? I feel good. Their heart's in the same place my heart is. So we have those meet and greets. COVID kind of threw a wrench into everything, as the whole world. But we were doing those 2 to 3 times a year with incredible turnout. So the primary care pediatricians were able to meet face-to-face these subspecialists. Karen mentioned grand rounds. The nice thing about grand rounds going virtual is not only participation, but in addition to the clinical presentations it also gives us an opportunity to update if there's any system things these community physicians need to know. Here's how we're doing on so-and-so. We can talk about a piece of quality. We can talk about a new service. We don't take up much of the grand rounds in that, but it is an opportunity to deliver that message if we need to. The other thing that's really important is our liaisons. They're out in the community. They're talking to the pediatrician practices. They're hearing one-on-one any concerns, any needs, any ideas for new services, new focuses on quality, or you know what, I'm just having a troubles getting a patient in, access things. There's any number of things that come up with our physician liaisons out in the community. They bring that information back. We're able to address it. Sometimes it's a one-on-one outreach back to that practice. Sometimes it's a change in processes that then we communicate back out that said, you know what, we heard you. These changes have been made. These things have been added, these new services. So it's kind of a one-on-one communication back and forth. And then we also mentioned Proficient Health Connect. Again, more of a one-on-one, but there has been a time, and not many because we would never abuse it, is if we needed to get out an urgent message for some reason, where we can go into that system and select by specialty and send out a message. I think in the time that I've been here, I've done it twice, but it was really, really urgent things that we needed to get in front of people. And then finally, during COVID, we did a lot of virtual town halls, and where we were really able to address some were targeted to the pediatric community, others were targeted to the medical staff as a whole, but we were really able to address, really some key concerns on messaging, masking, vaccines, PPE, testing, any number of things that every health system in the universe has been dealing with over the past 20 months or so. So those are some of the tactics. We don't do any of them super frequently because burnout is huge. Message burnout is just, they're going to turn it off if they get too many emails from us. So we're really thoughtful about how often we do these things, and we stagger them. The other thing that we know is that one time usually doesn't get the message across. There's no way. So you do have to use multiple tools in multiple ways to get that message across. And I think any communicator knows that. You write it once, that doesn't mean anyone got it. So, to really kind of reuse it. And then I would say, finally, we meet regularly with the Children's Hospital leadership team, and it's marketing, it's our physician liaisons, it's our government relations folks, it's our outreach, community outreach folks. And we sit at the table and we talk about, what are we hearing in the community? What are the needs that exist? And then we put together a plan, and we address all of those needs, and then make sure that our community providers know what we're doing. And that even involves in many, many ways, like we make an annual presentation to the advisory council about our entire marketing plan, because they're hearing things from their patients. If they see something in one of our multiple marketing channels we use, they're coming back to their provider and they're saying, what about this? Did you know about this? And things like that. So we want to make sure that the providers see what we're doing from a marketing standpoint as well. Again, it's to build confidence and trust in WakeMed Children's as a whole. And an awareness for the various services that we offer, so that basically at the end of the day, we're all singing from the same song sheet. And it really has proven to work.
That's great. Well, thank you so much. And big thank you to all of our speakers today. It looks like we have a couple of minutes left for questions. So if you have any questions for our panelists, please do ask them in the Q&A toggle in your Zoom platform here. Looks like we have a question here for Dr. Weber, does PM Pediatrics have partnerships in other locations like they do with Wake Med?
Yeah, we have 3 additional active partnerships across the country. We have Nemours up in the Delaware, Philadelphia market, not the Nemours branch in the Florida market. We have Children's Health in Dallas, and then we have a partnership with Inova in Northern Virginia.
Great. Looks like we have a question here asking about the recording. We will send a follow-up email with a link to the recording, so don't worry about that. We'll have you covered there with a follow-up email.
Hey, Erica, can I
Yeah.
quickly add to what Steven said?
Sure.
And other health systems may be interested in this. The nice thing about our partnership with PMPs is that it is co-branded. At least here in the Raleigh market, the Wake County market. So we have, co-branded with PMPs, and that really does work because you're bringing the knowledge of the community that they have with WakeMed Children's together with this really well-known pediatric urgent care brand together. So it really shows the collaboration between the two.
I agree with that.
Awesome. We have a question for, it looks like maybe Dr. Chilton. How has COVID-19 changed the way you're working with community providers?
I think, similar to, I'm sure, what everyone else has experienced, it has fluctuated over time. So a lot of the in-person things that we were able to do, down to something as simple as the meet and greets that Deb mentioned, we've been really hard pressed to be able to hold anything like that. I already mentioned sort of pivoting the Grand Rounds format to making it fully virtual. And actually, we probably would have transitioned back to doing that both in person and virtual sooner than now, except that our conference center became our vaccine clinic for a very long time. And so our space has been really limited from a perspective of having a room where people had enough space to spread out and be comfortable coming in. So because we've had a pretty good turnout and participation with the virtual format, we've stayed with that for right now. And we will reevaluate that going forward, whether it makes sense to ever really return to doing it both ways or not. I think the email newsletter that Deb mentioned, this word from WakeMed Children's that we send out, the one key thing we sort of did during the height of the, back when the recommendations and the processes and the policies and things were changing, it felt like sometimes every hour, if not, quicker. We did, she mentioned that we've been really intentional about the frequency of that. We wanted to make sure it was often enough that we shared information in a timely manner, but not so often that people were like, delete, 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 because you're saying the same thing. You're just trying to put something out to have something to say every month. And that's how we landed on that every other month format. We did during COVID pivot with that and send that out in more frequent cadences for a period of time because we knew we had the audience there. The system that PR uses to send that out, we can actually monitor our read rate or our open rate of those emails. And so we knew we were getting a good open rate. We had a lot of providers who were engaged in that information and reading the email. And so we at times we were doing that on a much more frequent basis during COVID. And some of that was in response to community providers reaching out to me in person and saying, hey, we really need to know what's going on in the hospital walls. Like, can you keep us updated more frequently during this time? Can you let us know what WakeMed is doing about this or that, or what, what the policy is on this particular visitation policy, for instance? People wanted to know so that they could set appropriate expectations with their patients. What is WakeMed's visitation policy going to be? If I send a patient over there, I need to be able to prepare them for that. And so we tried to step it up when necessary, and then back it off when, so that we weren't just noise to people when we didn't have anything meaningful to share.
The other, I was just going to add, Erica, to that, we were able to do together, PM Pediatrics was able to be a testing site for our pediatricians in the community and their staff, as well as many other healthcare providers in the community, emergency physicians, radiologists, and the like. And then the other, we also have done pre-surgical COVID testing for all the surgical subspecialties throughout the community, both employed and non-employed proceduralists, be able to coordinate that testing with WakeMed to take the lead on the pediatric side, because WakeMed was doing, the largest work on the adult testing side for, Raleigh and Wake County.
Last thing I'll add to that is that we coordinated a lot of vaccine efforts too. And so in addition to the efforts of our Health and Human Services, we also at WakeMed, and this was not specific to pediatrics, but in general, we were very conscientious about, when we had enough vaccine to share, when people met criteria, we had providers in the area that met criteria, we participated in helping our providers get vaccinated. And then when we got to the point where, other patients were being vaccinated, we were hand in hand with our Department of Health and Human Services in how to go about that. And so as that specifically affected pediatric providers, both for themselves initially and then eventually for their patients 12 and over, I tried to make sure that we were intentionally communicating with them as well, and making sure that we were continuing to be a resource to them to help them be able to start those efforts, because we recognized that we had a lot more leverage as the big community health system in the area, along with the health department, than they had as small practices out there trying to figure it out on their own.
Awesome. Dr. Chilton, it looks like we have a follow-up question to something you had mentioned earlier. Do you guys have a formal process of a way to collect feedback from WakeMed providers and community providers?
So yes and no. I would say that the formal mechanisms that exist are the people who participate on this Children's Advisory Council that we've mentioned are representatives from probably 6 to 8 of our largest, most influential practices in the area. And so, quarterly they're coming into the hospital, they're meeting with us, and we're able to get direct feedback from that standpoint. We also we've mentioned this Grand Rounds thing a couple of times, which doesn't seem like a big deal, but some of the ways we've learned how to evolve that over the years has been by surveying the participants in that. And so we sent, it's not anything fancy. It's been SurveyMonkey. For many years, it was me making up the questions and just sending it out to the participant list and asking them, what do you find helpful? What do you not find helpful? How can we make this better for you to make sure that we're providing the service that you need and the information that you want from us? But there's so many informal mechanisms that exist that I think we've mentioned as well already. But the liaisons from marketing and physician relations who go around and just check in on the practices, and then when they identify questions or a need within a practice, depending upon what it is, maybe it's, gosh, we didn't know this new subspecialist is in the area, can you have that pulmonologist come out and meet us for lunch? They say great, and they set that up. Or they want to know why something changed significantly in the children's hospital with a service or not, and then they'll tap me or someone else from leadership to go and have a conversation with a practice. And then, I've been in the community now for a long time, and a lot of the community providers I know in person too. And so they informally, most of them don't hesitate to pick up the phone and shoot me a text or give me a call when they have a question, or not infrequently a beef about something that they want to talk about.
All right, so it looks like we are coming up on time. So I want to give another big thank you to our speakers today. And before we conclude, a recording from today's webinar will be available soon. Please look out for a follow-up email with information on how to view that recording. If you would like to learn more about Proficient Health or speak with a member of our team, please contact us today. We have an email and a phone number there listed for you. Thank you again for attending today's webinar, and have a lovely day.
Thanks, everybody.
Thank you.